And somewhat new treatment now available for those testing positive for COVID-19.
President Trump took this treatment last year. This week, Governor Abbott said he received it hours after testing positive. It's called monoclonal antibody treatment.
Channel 5's Crystal Martinez explains what that treatment is and how it's being used to save lives in our area.
In a parking lot next to the hospital, DHR staff is working from a mobile unit, delivering a monoclonal antibody treatment to people who have contracted the coronavirus. So far, they've been successful in treating around 500 cases.
Daily, we would take about 4 patients a day, since it is a lengthy treatment. And we have limited space here at our mobile unit.
But testing positive for COVID isn't enough to get the treatment. In order to receive it, patients must meet a certain criteria.
They have to be within 10 days of the start of the symptoms or within 10 days of their being diagnosed positive. And then they have to have a risk factor.
Dr. Rao says those risk factors include adults and children, ages 12 and older who have certain diseases or health issues.
You have to have asthma. You have to have diabetes, hypertension.
But how does it work?
Monoclonal antibodies are synthetically generated antibodies that actually bind to the virus. Once they bind, the cells in the body are capable of actually scavenging the viruses along with the antibodies and clearing them from the blood.
And most importantly, it's able to stop the virus from getting worse or make you sicker. Ideally, it'll prevent people who test positive from eventually needing to be hospitalized. As far as getting a treatment, it all starts with an appointment. Once it's made, you have to wait in your car until health professionals in the unit are ready to treat you.
It is in stages, so we need to let pharmacy prepare the treatment. So that is about 45 minutes to an hour. And then the patient will get about an hour of IV infusion.
Patients stay for about an hour after getting the treatment to make sure they do not have an adverse reaction. Dr. Rao says he hopes at some point they'll be able to use the treatment as more as a preventative measure, meaning patients would not have to test positive for the virus to get treated, just be exposed. Crystal Martinez, Channel 5 News at 6.